Welcome back. This is ongoing value analysis program, and now what we're going to talk about is accountability. And specifically, accountability is about the governance of your program. It's an extremely important part, just as all these other elements are, but you have to build it in. And you'll see, I recommend that you build it in from the beginning of the program. So let's talk a little bit about what exactly is accountability in a value analysis program. So it refers to what type of governance structure your program will use in order to function most effectively in your organization. And there's really two basic models. There's a centralized model and a decentralized model, and I'll go into what I mean by both of those. But you have to remember that every hospital, every healthcare system has a governance structure. It's been there, it's existing. You have to understand and tap into that governance structure because you're going to want to position your value analysis program somewhere in that governance structure, meaning you're going to have to be reporting up to somebody or some groups of people who are going to help you and support you along the way. Trying to go out there and do this on your own is not going to really work. Been there, done that. I don't have to do it again. We try to do a few things on our own without really tapping into the governance structure, but it wasn't until we really were able to tap into the governance structure for value analysis that we saw it start to perform in ways that we really wanted it to. So keep that in mind. But I'm going to show you how you can do that and how to do it from the very beginning. So first thing, let's talk about a centralized model. And really what a centralized model is let's just say, first off, if you're a single hospital and you're going to do a value analysis program, you are a centralized model. This only applies when you have more than one hospital. If you have more than one hospital and you have a centralized model, really what's happening is the system value analysis program is really what's running the decision making for your organization. Typically, that's with an operating model. So if your healthcare system has an operating model where you have a single board and single senior management team and a single supply chain services department, they're probably going to want to have a centralized model. It's going to be the most efficient way of doing it. And so what are the pros of that? Well, one is scale. If you're a large organization, we had 29 hospitals. So when you have 29 hospitals and you're coming to the table and negotiating over pricing, you have a lot of scale and therefore a lot of clout with buyers. Because in our situation, we had a lot of market share, and with that, the vendors were willing to bring things into us and negotiate in good faith because of the size of our hospital system. Also, experience. When you're negotiating for a large number of hospitals, you now start to get a lot of experience, and not only that, but you can attract people who have had a lot of experience in other systems, and your talent pool becomes much more experience as a result of that. And so it's nice because you can attract people who are good at what they do, and therefore that helps your organization get the best possible deals out there, and also identify what are the most quality deals out there. So I think it's just one of the things that you really have to kind of keep in mind when you're looking at a centralized model. It has great negotiating clout. There's no doubt when you come in with a big system and working with a vendor, if you're a real big system, the vendors are going to respect you more. If you're a single hospital and you don't have a lot of market share, you're probably not going to have a lot of negotiating clout, and you're probably going to get beat up on pricing. And that's just the reality of it. So anytime you can develop scale through a centralized model, you're going to have much more clout. And also inventory management. You don't have to have a lot of different systems. If you have a centralized model, you typically have one inventory management model, and therefore it helps you keep track of your what's going on with your inventory, and therefore what's happening with your supplies. Remember, like I said, 166,000 SKUs, stock keeping units out there. That's a lot to keep track of. But what's nice is if you have a single system to do it, it makes it a whole lot easier. And so it also gives you some advantage in terms of understanding what product is moving across a large system, and it gives you some sense of how you can negotiate with the vendors as a result of that. Now, the downside of it, the cons of this, is legal issues with the coordinating facilities and holding companies. So an operating company has a single board and a single senior management team, and typically a single supply chain services department that manages everything from the corporate level. In holding companies, it's not uncommon for an organization to buy a bunch of different systems and then let them manage themselves. And when you do that, you also get some disadvantages in terms of scale because they may want to manage their supply inventory as well. And they may not be able to get the same scale that they could at a much larger system level. So trying to negotiate and move around the legal issues, coordinating facilities and making sure that they're willing to have buy-in for particular products, categories, may not always be easy. A lot of them, a lot of the bigger holding companies out there have figured out ways to streamline this across time, and so they've gotten better at it. But it can be a hindrance for those who haven't worked that out yet. And it may not be supported by independent medical staffs. You may, and don't be surprised when you have your medical staff saying, no, we want to make decisions regarding our local facility, and we don't want somebody else coming in. And they may simply just, have a vote and say, we're not going to do it. We're not going to support it. And that could become a problem with a centralized model. It's not uncommon. Medical staff say, we just don't want people from corporate telling us and dictating to us what we're going to do, decisions we're going to make at our facility. And a lot of them had a long history of making those decisions on their own for a long time. But the world is changing, so that may not be possible in large systems anymore. So let's talk a little bit about a decentralized model. It's just sort of the converse, which is the pros. It appeals to more independent medical staff. If your hospital is in a position where it has a dominant position in that particular market, they may be able to have some sway with the vendors, and therefore the medical staffs feel a lot more independent to be making those decisions on their own. And so it appeals to that type of group. Maybe more desirable for communities with specialized needs. You may be in a community where you're in a retirement community and you really service a particular patient population, and there's certain needs that they have that you want to be able to negotiate in good faith for them as well. You may not be able to do that if you're part of a large system and everything comes in with the one size fits all. Well, your community may not be the one size that it fits, and therefore a decentralized model gives you some leeway in being able to negotiate for the specialized needs of your community. And like I said, the cons of it is less impact on scale. If you're out there by yourself, it's really hard to negotiate against the big systems that have a lot more scale and a lot more negotiating clout. What I think is, which one do we recommend? It's obviously, it's the best model is the one that creates the real results and achieves your purpose. In order to work with your medical staff and create value analysis programs, you have to have their buy-in, regardless of what model you're going to be developing. And so find the one that works for you and make sure that it's achieving your purposes. And if it is, then more power to you. It doesn't matter which model it really is. But you're going to find that some are going to be more advantageous in certain environments than others. So be aware of that and start to think in terms of what does your local community want to do in terms of the type of model that it would prefer to have. And that will be a big driver for what you ultimately end up deciding. So my recommendations obviously is determine governance before starting up your program. Do not start up a program and then say, I wonder where this fits. I think ultimately what you really want to do is, regardless of what type of governance structure you choose, make sure that it reports to both the medical and administrative leadership, meaning it has some way of connecting into the governance structure, whether it's reporting out to your MEC or reporting out to your C-suite. I don't think, or your senior management if you're at a system level. I don't think it really matters. I think what's important is that you have a reporting requirement to both of those groups. Keep them informed. The more informed they are, the more supportive they'll be. The more supportive they'll be, the more likely you are to have a successful program. I think you also have to develop a defined workflow between committees. And we'll talk about this in just a second, but you heard me say that previously in terms of the infrastructure. Have a workflow. And so I'm going to show you one example of a possible workflow and one example of the types of committees that you can have in your workflow. But don't feel like you have to stick to what you see on these slides. Just know that you have to figure out what's going to work in your organization and then come up with that workflow and define those committees the way you find it's going to be most beneficial for your organization. But here's just an example of them. So for committees, we had a commodities committee. The vast majority of products are going to go through commodities committee. These are most products come into as commodities. This is everything from toilet paper to, the type of detergent they use to clean the dishes. I mean, it's that literally that level of analysis is not going to be needed by any value analysis program. You need a separate committee to do that. Commodities committee runs this stuff through on a regular basis. Most organizations have one. They're very good at it. Let them do what they do best. And so when something's commodities, goes there. Sometimes though things pop up in commodities that you really don't think that they would be value analysis or would go into any of these other committees, and you should have an out. You should have a workflow for a decision point in commodities, so that when something needs to get kicked out, where's it going to go, how's it going to go there, and then what's the feedback to the commodities committee in terms of what was the outcome of that decision that when they kick something out. You just have to have that workflow defined, and you'll see on the next slide when I put this together for you, you'll see a example of a workflow, and I think that's going to be the important thing for you to see, that these are connected to one another. Technology review committee, sometimes you're going to be out, looking at monitors or different types of ventilators or different types of beds or something like that, and you want somebody to review the technology behind a decision. A lot of organizations will have a specific technology review committee. That's what we had, and so we would send it there. As a general rule, physicians and nurses may or may not get involved. Depends on the type of technology. If it's a hospital bed, I can guarantee you the nurses are going to want to be involved. Somebody's going to want to have a say in this. We did one where we brought two different types of beds out. We had nurses go in and work with the beds and see which one that they thought was a better bed for them in terms of taking care of patients. And so it's going to be important to be able to have a technology review committee, but that technology review committee may need to sort of bring in other subject matter experts to help guide that. It's almost like having a value analysis team, which I'll touch on in a second, but specifically just for technology. Value analysis teams, though, are specifically subject matter experts who are going to help you with specific types of product categories. Whatever, surgical mesh. Well, you run the usage list, you find the 20 surgeons who are using surgical mesh, and you bring as many of them into a room and you have a discussion around surgical mesh. You get the evidence out, you start looking at what people usage and preferences are, and start having an open, honest dialogue about what is the best mesh that we would like to use within our organization. And so that's when you have those discussions. That's the value of a value analysis team. You can have that same type of analysis for technology review, but technology review would have to pull out a value analysis team specifically for that. We had a supply exception process committee. So not everything that is needed will come on contract. And what I mean by that is sometimes there will be specialty things. There'll be, there's this this one-of-a-kind thing that we really need. And you need a process for monitoring that and for an approval process or a denial process for it. And so we had a small committee. It was a group who would look at things. I was on that, and a lot of the clinical stuff would come to me. And a lot of times it would just simply was a phone call to the physician who was making the request and saying, can you explain to me why you really need this, why no other product can do it, and why this one product really has to be used. Because there are times when you can have things that are on contract but are not on formulary, and there's a way for doing that. And sometimes you can, when you get enough things coming through supply exception, you say, we'll put it on contract, but we're not going to put it on formulary, and we're going to let people request it specifically for specific purposes. And this is one way to do that. You also have to have a strategy committee. A lot of times the value analysis committee will function this way, but I think sometimes in particularly large organizations, you may start to look at certain types of devices, whether it's in cardiac care or in neurosurgery or in spine or in orthopedics or something, where you start looking at specific product categories and saying, we are going to make a commitment moving in this as a service line. And you want to be able to do that, I think, more with a strategy committee rather than a value analysis team. You put together a group of experts, they're going to say, yeah, of course, buy it. We're all behind it. But a strategy committee is more about, say, like you're going to regionalize a particular service, and therefore you want to regionalize a particular product that you're now going to start to purchase for that service. A value analysis team may give you some insight into the type of product that may be best to be used, but they're not going to tell you where to put that service line in what hospital or what region. And so you're going to need a strategy committee to really help guide that process and help therefore guide the determination whether you need to have that product in your organization or not. And then the last one, of course, is the value analysis committee. To me, that's the oversight committee. That's the one who's running all this show. and really is getting feedback on what's happening at all of these different committees. With Commodities Committee, it was for us, it was just simply we had a group that just met and we simply looked at all their recommendations, and if they had any report outs, meaning they wanted somebody to look at something that they were looking at, and another committee to look at something they were looking at. But as a general rule, we were providing oversight to the entire program. And at times also we're providing insight and decision-making capabilities. So we would get recommendations from these various committees. It'd go through Value Analysis Committee, and then, of course, to supply chain, because they're ultimately the ones who end up signing the contracts. So it was a good, nice workflow, and I'll show you what that workflow is here in the next slide. So I'm just going to walk you through it, and this is just one example, but my recommendation is you have something like this in your organization. At some point, somebody's going to ask you, how was that decision made? And you're going to want to be able to walk them through this. So starting left to right and top to bottom, we're going to go up, is this product a commodity item and up for contract renewal? If yes, it goes to IFCC, Commodities Committee. And if no, then the next question is this a request for a new product for an established service line or support function and is not considered a preference item or strategic? The answer is yes, right? Now we're talking Technology Review Committee. If the answer is no, is this a request for a product new or existing contract renewal, which is a physician or clinician preference item? If the answer is yes, is this a request for a product to be added to the supply formulary? If the answer is yes, it goes to the value analysis team. Remember, this is the one you're going to sign a contract for. It's on formulary. It's available to all physicians. If the answer is no, it's going to go to the supply exception process committee, right? Because you want to keep it off the formulary because you only want to use it for the exceptions. And you want to have a committee that looks at those exceptions. You know, if you get enough exceptions over time, you begin to start to realize that maybe this is something we need to have on the formulary, right? You get so many requests and you start realizing, okay, maybe this should actually be available to everybody. But if you don't, if it's just truly just one of those one-offs, and we had that happen one time where we thought something was really needed to be on our supply formulary. We made it on supply formulary, and in the entire next year, we only bought 2 of the products. So for a whole year, for a hospital system that had 29 hospitals, I couldn't believe the amount of support behind putting this on the formulary. But when we realized it wasn't really needed to be there, so we put it into our supply exception process committee and took it off the formulary. And again, the following year we had no requests for it. So it kind of shows you got to be careful about what you put on your formulary and what you do. The other side of that is this a request for a product, new or existing, which is physician or clinician preference item? The answer is no. Is this a request for a product that impacts strategy or population health? The answer is yes. It goes to the strategy committee. The answer is no. It goes to the value analysis committee. And in further review, if they think it needs to go back to one of those other committees, you can obviously always send it there. And it makes it seem like when I read it to you, it might seem like it's sort of a long, laborious type of process. But actually, when you work through it a few times, it goes pretty quick. In fact, the Commodities Committee, they pretty much know what they're going to be reviewing anyway, so it's not a whole lot of thought that goes in there. It's only when things start to get kicked out, and particularly when they're looking at preference items or strategy. Because if they're preference items or strategy, there's probably another committee that's really going to need to analyze them in a lot more detail. And so for us, that's where the lion's share of the workflow was, meaning in terms of decision making. But over time, you get pretty good at that, and you can pretty much look at a product and go, I think it's going to need to go here. You generally don't work through this whole algorithm, but it's nice to have the workflow defined somewhere so that when somebody comes to you and says, hey, who made a decision and how did it get there? And it's like, well, the reason that ended up in strategy committee is because we're looking at that maybe as a service line, and that product was going to be part of that service line, and that's why it ended up as strategy committee. And so now all of a sudden people go, oh, I see, that's why you bypassed everybody else. Yeah, that's why. Who was involved in that strategy committee? And these are typically senior level people in the organization. It can involve physicians. It can involve senior management team members. It can involve people if you have a strategy group in your organization. So these are pretty high level discussions that are happening there. So it's important to make sure that people understand that was a specific decision that was made for the organization at that level, and that's true for all of these, but you want them to have a way of understanding that process and that workflow. It's a lot more organized this way. It makes more sense to have something that's written down and that other people can follow and track over time. And not only that, but all these committees keep minutes, and we keep track of everything that's going on with this, so it's a nice way of being able to to say over time, well, what happened with all these decisions? So now you start to get a sense of how your program is functioning. Is this workflow working? And if it isn't, what do we need to change about it? And so that's one of the things that's nice to have it written down somewhere, so you can go back and say, wait a second, it's right here. We're not asking the right question in this particular box. We need to break this into 2 boxes or 3 boxes, or whatever it is, and add committees or subtract committees. Now, if you're really small, if you're an 18-bed critical access hospital, a pretty good chance if you're going to have a workflow, it's probably going to be just one committee just looking at everything, and it's going to be a pretty small group. But, if you're a large organization, you have, dozens of hospitals, and you're operating out of multiple states, this workflow is going to be a lot more detailed, and it's going to need to have probably a lot more committees that are involved in this work and support functions for it. So it all varies. It depends on the size of your organization and how complicated a value analysis program you want to have. But I think you can start with something pretty simple and then build up to something like this. If you're small enough and you think you want to be able to move in this direction, use this as a sample or starting point, and add or subtract as needed. So as always, any questions, feel free to contact me at my email or at my website. And we're going to move on to the next section. And once again, have a great day, and thank you for listening.